Hey guys, Dr. Derry here, owner of Revision Health Services here in Jacksonville, Florida. And today I have a great chiropractor with me today. His name is Dr. Brett Lukas. He owns Life Family Chiropractic in Nocatee. He's a really, really good guy. And today we're going to talk about his practice, but we're also going to talk about how he uses HRV and other ways to measure sympathetic and parasympathetic balance to help people get out of pain and stay out of pain, as well as traditional use of chiropractic techniques and how he blends that based off of clinical presentation and what the patient needs. It's a really, really cool blend. I'm excited for you guys to hear what he has to say. He's a really, really good practitioner. Hang with me and we're going to have a great interview. All right. Well, thank you for joining me today, Dr. Brett Lukas. You're a chiropractor and a Nocatee, owner of Life Family Chiropractic, a good friend of mine, amazing chiropractor. I've loved working with you in the past, and I've had a lot of good success. I'm excited to do today's interview because your style is a little bit different, and I'm excited for other people to learn that as well. So,
Awesome.
tell us a little bit about you and your practice.
Yeah. Thank you, man, for that amazing introduction.
Yeah.
It's always fun to do these and to be able to talk with other amazing docs such as yourself. As you said, we've worked together with a handful of people, and it's really neat to have that great symbiosis between what it is that I do and how I specialize in helping the body recover, and what you do that's much more specified to what that
Mhm.
person is going through as far as injuries and recovery. So it'll be fun to kind of dive into the weeds a little bit on some of that
Yeah.
stuff and the differences. But yeah, I moved here to Nocatee from Southern California. I practiced out there for about 7.5 years and had a great practice. We loved it. But my family's on the East Coast. My
Yeah.
wife's family is on the East Coast. We're getting ready to start having some little kiddos of our own. And
Yeah. Yeah.
so, of course, the natural move was to get out here closer to family. So we chose Northeast Florida. It's been unbelievable. And so we got out here Memorial Day of 2021. We just hit a 1 year mark in the practice. We opened on September 8th of 2021. So we're just
Nice.
over 1 year out here.
Yeah.
And it's been unbelievable. It's been an absolute blast. It's been an honor to be accepted and welcomed into the community the way we have, and to be able to help families,
Hmm.
kids, seniors, really people of all ages experience not only better health, but we named our practice Life Family Chiropractic because it's about having a better life in general. And you don't have the best life you can if your brain and if your body aren't working the way that they have the potential to.
Hmm.
So it's really about unlocking that potential for people, and it makes it easy to get excited to go into work every day.
Yeah, absolutely. Yeah, well said. I think being in this area is really, really nice, and we're privileged to be able to serve such a good and strong community. And so you nailed it there. But you also mentioned the brain and the nervous system connection, and so I think that's really what makes you different from other chiropractors in the area and how you practice. Especially because you can objectively measure some of that as well. And
Yes.
in our field, numbers is good. People love numbers. So run me a little bit about like how that is different and what your process looks like.
Yeah, I'd love to. So one of the big changes I made in practice a few years ago was getting away from the, I guess you could call it traditional
Mm,
chiropractic care. Not that there's anything wrong with traditional chiropractic care, but
sure.
really trying to take that step forward with what research, with what technology we have available to us now, and how the brain
Mhm.
works, how the body works. And when we start to dive into the brain and the body, that connection is through the nervous system. And
Sure.
so if we know that the only way you move your hand is because your brain tells it to, the only way you digest your breakfast is your brain tells it to, right? The only way that your immune system is coordinated is it's all under the direction of the brain.
Mhm.
We know that every internal organ function, the way our body works, holds itself up under gravity, bends, twists, turns, recovers, heals. All of
Sure.
those processes are guided by the brain, and that connection through the nervous system is critical because your
Mhm.
brain's stuck up here,
Yeah,
right?
yeah, yeah.
So it can't do anything unless it can communicate somehow with those end organs or the muscles or whatever it is. So
Totally.
when I started to realize that we now have the potential to view objectively how the nervous system was functioning, how that connective piece was working. And
Mhm.
we could measure that and say, wow, Dr. Michael, your neuromuscular component, right? The part of your nervous system that controls your musculature, how you hold yourself in your posture, that's doing great. But you know what? Maybe the part that you don't feel, that deeper, the autonomic nervous system that controls organ function, maybe that's not working as well as it could. You
Sure.
may not feel that, but that's still going to be not only affecting you on the inside, but it's going to be draining your body of energy if you're inefficient. Well,
Sure.
now you're not going
Sure.
to be
Yeah.
able to recover from something as well. You're not going to have the same zest for life as you might if your body wasn't leaking energy
Yeah.
all day,
Yeah.
every day by being inefficient, right? So being able to
Mhm.
measure some of these things and see it on a clear printed out scan is not only beneficial to me as a provider, because
Mhm.
now I can say, I've got some targeted areas that we need to work on
Sure.
that I may never have been able to find had I not been able to measure this,
Yeah. Yeah.
right? And it's also beneficial to the practice member, right? Or to the patient, because now they have the chance to see, oh, now I can tell where my issues are really stemming from. I may feel
Mhm.
it downstream. I may not have felt that. My child may not be able to tell me what it is that they feel, but
Mhm.
we can see these things on hard, measurable data and then see the improvement over time. And of course, they get to feel that as well, which is fun.
Yeah, great synopsis. I'm with you every step of the way. I totally get it. And I've seen the patients that have had the opportunity to improve themselves holistically, right? They feel that change that you're talking about, and they feel the change of, someone like myself and what they do for them, and improving their resiliency. But when you speak about these measurements, I guess the first question that patients always ask me, like, these scans, do they hurt? What's that process look like?
Yeah. So they're totally pain-free. They're
Sure.
gentle. They're easy. They're quick. We do these scans on everybody from babies to seniors.
Hmm.
One of the scans, the neuromuscular scan, that one we don't do until a child's about 7 or 8 years old. And that's just because they're not big enough.
Sure.
So when
Sure.
they're really tiny, there
Yeah,
are
yeah,
certain things they're limited on, right? But
yeah, yeah.
the other two scans that we do, so one's a thermal scan and one's an HRV scan, which I'm sure we'll get into a little bit
Yeah.
more on what those are, but we do those on everyone.
Okay.
And there's no pain. They're quick. It's just like an Apple Watch, how it reads through your skin.
Yep.
So we can see what's going on the first scan, which is an EMG. It's measuring how the brain is communicating with the muscles.
Hmm.
The second scan is a thermal. What that's measuring is actually measuring the slight temperature differences between either side of your spine.
Okay.
Now, what we know, which is interesting, is that the same nerves that control blood flow to the skin, which would obviously regulate temperature of the skin,
Hmm.
are also responsible for regulating the deeper internal functions at that level. So
Okay.
if there's an inability or dysfunction in those nerves, we can measure it on the outside, but we know it's actually affecting the inside. So I call
Okay.
that like our fuse box scan. If somebody's got a blown
Yeah,
fuse in
yeah,
their house
yeah.
that goes to the kitchen's not working so well, right?
Yeah.
Everything else in the house might be okay. Well, the same thing happens with us. If we have an area of our spine that's got a blown fuse, well, that area on the inside is not going to be working as well as it should. Right?
Hmm.
So that's the second scan. And then the third one is our HRV, or our heart rate variability scan. I like to call that, it's like our battery power or our gas tank,
Yeah.
right? We can
Okay.
see how tough has it been for someone's body to get through their life, right?
Hmm.
Not everybody is at the point where they're able to give to their life and really live it the way they want to. A
Hmm.
lot of people just feel like they're trying to get through. And we can see, and people say it all the time, oh, it's really been taking it out of me, right?
Yeah,
And we
yeah,
can say,
yeah.
yeah, well, yeah, your battery is drained, my
Yeah.
friend. Yes, it has
Yeah.
been taking it out of you. So those are the three different scans. It takes us a total of about 12 minutes for somebody to go through all three scans. And
Great.
again, painless, easy, and it gives us some amazing data.
Great. Great. And I think prior to meeting you, I kind of knew the thermal scan, the EMG, and I think those are all great. And I think it's a great thing to include. But the HRV, I think that really set the standard when I first met you and you started talking about that, because that's becoming more and more prevalent. And it's
Mhm.
just some really, really cool measurements. And so run me through the HRV. Like, what is that?
Yeah. So our HRV is actually really cool because there's an added component in as well, which I'll get to in just a second. But the HRV itself, what it stands for is heart rate variability. And I know you know this, but some of the
Yeah,
listeners
sure.
may
No,
not, right?
go ahead.
So it stands for heart rate variability. So what we want in our heart rate, let's say, for example, somebody has a heartbeat or heart rate of 60 beats per minute.
Mm-hmm.
So every second, their heart would beat in theory.
Mm-hmm.
What we don't want is a heartbeat that is exactly on 1 second in between,
Yep.
right? What we'd rather have, and I'll explain this a little more, but what we'd rather have is maybe something like 0.98 seconds and then 1.02 seconds. And
Sure.
so your heart is beating on average 60 times a minute, but it's sort of spread out. Sometimes it's closer, sometimes it's further.
Mm-hmm.
What that means, and the way that I like to explain that to our members of our practice is your body's ready to adapt to a faster heart rate or to a slower heart rate. It can do
Sure.
that in an instant because it's already working within that range. If you're exhausted, if you're fatigued, I mean, how many people know you just put everything you can on autopilot,
Yeah,
right? You
yeah,
just say,
yeah.
I don't want to think about it.
Yeah,
I
yeah, yeah.
can't do it. I can't do it. Well, your body does the same thing. And it almost is like it puts your heart on autopilot and it says, just beat every second.
Mm.
And we're not going to be very adaptable. We're not going to be able to change very much and handle new stresses, but at least we're not dying,
Yeah,
right?
yeah, yeah.
And so that's not a good place to live life for a long period of time.
Mm-hmm. Agreed. Yeah, yeah, great explanation. And I think intuitively we would want if okay, so if we had a consistent heartbeat at exactly 1 second, we think that's good. But we want that
Right.
variability. And from my talks with you, like having that variability means your parasympathetic system or the restful state of your body is more dominant and not the sympathetic, the fight or flight response. And
Yes.
so when you're in pain or chronic discomfort or stuff's going wonky internally, you could be in more in that sympathetic state. And then that can be picked up with your measurements. And so people are starting to understand, the importance of the stress response and how that plays into their body and their how they feel during their day and their recovery. And so I love that you measure the HRV. And I think you brought in some like pre and post scans, right?
So we do have some pre and post scans. Let me try to see if we can pull a few of these up here.
Yeah,
Let's
no problem. I
find
appreciate
out.
you bringing them, and the scans are really neat. That objective change matching with what the patient experiences. I mean, when you can bring those together, it further explains the change in the things that they've felt. And so I think that's really what sets you apart is having that objective change that you're holding yourself accountable. And then you're also able to keep a little bit better grasp on the patient and what they're feeling and what their body's going through.
Right, exactly. So I've got one pulled up here, which is an interesting one that I
Yeah,
can
yeah.
chat about a little. Let's see if we can share. Oh, so you'll need to allow the screen share on there.
Oh, that is my
But what's interesting while we do that, talking about the sympathetic versus
good.
parasympathetic nervous system in
Yeah.
general, um, there were a few studies that I had pulled up that I'd come across a long time ago that are always fun for me to look at. But what they both are essentially pointing to is the way that the brain gains its information about its environment is
Mhm.
through function of the spinal cord and the spinal column. So if your spine is stuck or fixated in a certain position, whether you feel that or not, when you're stuck somewhere in your spine with or without pain, your brain starts to get stuck in that sympathetic
Sure.
system. And we
Hmm.
say sympathetic is like survival. It's like fight or flight.
Hmm.
Your brain thinks that there's a bear in the room with you. And if there's a bear in the room, you don't care about digesting your breakfast. You
Hmm.
don't care about your immune system. You'll catch a cold. Sure, I'll deal with that later, right?
Yeah.
You don't care about focus. You're not going to learn new skills as a child. You've got all of these different processes that your body wants to do for longevity that it says longevity doesn't matter. There's a bear in the room, right?
Yeah. Yeah.
It's
Yeah.
all
No,
about
get it.
right now,
Yeah.
survive. When those areas are stuck or fixated, your brain is in survival. What chiropractic does in a very short summary is we're releasing those restrictions, those areas that are stuck, and that allows your brain to shift back into that restful parasympathetic state and say, you know what? Now there's no bear. We're in a safe place. We can use our
Mhm.
energy to recover. We can use our energy for digestion, for
Yep.
learning, for brain development. That's where we want to get people. And that's one of the things that we can measure with the
Yeah.
HRV and with the other scans. So if you're all set, I've got a
Yeah.
one example here I wanted to chat about real quickly.
Yeah. Bring it up. I'd love to see it.
All
Yeah, good
right.
point about the HRV. I mean, there's a reason why that high level athletes use that as well to figure out when they're gonna perform the best. I mean, it makes sense. It just completely makes sense.
Right. You don't perform the best when your brain is worried.
Yeah, yeah, yeah. Well, thanks for
All
sharing.
right.
Okay, what are we looking at here?
So let's see if I can also draw on this here. So what we're looking at on the left side is one of our thermal images. And on
Okay.
the right side is our HRV measurement. And I'm going to talk a little bit about the other aspect of HRV that we can measure on here as well, which is the left and right sides. All right. But
Right.
first, this thermal image over here. So you can see all this blue and all the red.
Sure.
What we want to see on a normal image here would be a gradually increasing temperature. So it'd be like a V shape going up and out to the side with red bars that get larger and larger and larger as we go. There may
Okay.
be a couple little dips along the way, but it should generally transfer out in this V shape.
Okay.
This was a boy who's about 7 years old who came in, and he had been a torticollis baby. He has had all sorts of neurological type symptoms that had shown up,
Mhm.
was never diagnosed with anything in particular, very difficult to sleep, difficult for digestion. And when we took a scan of him, this looks nothing like gradually increasing red bars.
Sure,
Does
sure.
it? There is a huge dysfunction here in the way that his internal nervous system, that autonomic nervous system, is working.
Hmm.
This would be a normal, what we would want to see as far as the HRV.
Okay.
Okay, so the HRV, this white dot, should be way up here in this green box somewhere. It should be as close to this middle line as possible,
Got it, got
and
it.
it should be as high up as possible. This is like your battery power. The lower
Got
you
it.
go, the more drained you are. All right. The left side of the HRV compared to the right side is our additional aspect that our HRV measures. And
Okay.
what that's measuring, have you ever had a time where you feel anxious and your palms get a little clammy?
Oh yeah.
Yes. So that response we can measure with our scan. So it's measuring your skin conductance. So as you get these little tiny periods of anxiety, not something that you're aware of on a
Hmm.
conscious level, but
Hmm.
as the scan is doing its measurement over a 3-minute period of time, your brain may have these little shifts into, is everything okay? Wait a
Yeah,
second, am
yeah,
I
yeah.
safe? Is there something that's around me that's a threat?
Yep.
The machine is picking those up. And what that's going to measure is the left and right side. The further left we go is our sympathetic side. That's, are we in that survival? Are we in that fight or flight?
Okay.
You can see his initial scan. He
Yeah,
was
yeah,
down
yeah.
here, he was off to the left side of that line. So his brain was stuck in that survival sympathetic side
Sure.
as a tendency, right? As a lean. We also know, and this was his original scan, this first one, it's the same as this one above. Lots of blue, doesn't look the way it's supposed to at all.
Got it.
Dysfunctional, body not working, and we could see that on the symptoms. What's cool is when we look at the new scans that we took down here, let's see if I can zoom a little. Oh, there we go.
Looks good.
What we see on this new one uh, is, oh, let's see. Oh no. I lost my, oh well. What we see now here is, like you said, looks good. We've got
Yeah,
the
yeah.
that general V shape of red bars all coming up and out to the side. And we
Sure.
can also see that his white dot has come right back to that center line, and it's
Yep,
even
yep.
moved up slightly.
Great.
This is a
Great.
perfect
Yeah.
pre and post from what we see.
Yeah, yeah, yeah.
We've managed to
How
get
long did
his,
that take?
this scan right here was taken 1 month after his first scan.
Nice.
Let's double
Nice.
check here. We got 6-1. Oh, sorry. So a month and 12 days, right?
Okay. Okay.
418 to 6-1. So
Okay. I love
within,
it.
yeah, about what, 5 or 6 weeks, he was able to go from total dysfunction to nearly perfect nervous system neurological function.
Nice.
And that showed in his symptoms as well. What's
Yeah.
fun is being able to see that, being able to see the response in him, the
Mhm.
way he goes through his life.
Yeah.
But for me in my practice, having that zoomed out vision of
Hmm.
no child is better with dysfunction, period.
Yeah. Yeah.
No child is better when their brain isn't as balanced as it can be. Whether
Sure.
they feel it, whether they have symptoms, those are irrelevant to me. What is relevant is what does the data show on the technology? Just
Mhm.
like a heart scan. You might go in
Yeah.
and get a heart scan, you have no symptoms, no high blood pressure, no anything, and you might have blockage of an artery at 60 or 70%,
Yeah. Yeah.
right? You
Totally.
could feel nothing and you could have cancer inside.
Sure.
What we feel is a really bad indicator of how we're functioning. And you know
Yeah.
that well. You see dysfunctional motor patterns in people all the time that don't hurt yet, right?
Yeah. Yeah.
Doesn't mean
Yeah.
they're not going to hurt.
Yeah. Yeah, I hear you. I think that's really awesome. And to have that profound of change that quickly, I think that's not a, when you can combine with how they're feeling with what's objectively measured and what you're seeing the numbers say and bring it all together. I think that's a good aha moment for everybody of like, okay, we're on the right track, things are going well. And I think that's what I really enjoy hearing about your practice and how it kind of sets you apart from others is that you're not the person to come in there and just focus on one area. You're going to make sure that that person is taken care of and their family, right? You're working on children as well as older adults, and so you're really getting people set up on the right path.
Yes. And that's how we like to view it is we're trying to get you set up on the best path for you, whether that's a
Yeah.
path to healing and recovery from an injury, whether
Yep.
that's healing and recovery from some organ type system
Yep.
dysfunction or a symptom or problem, or whether that's a child who just wants to be on the right path as far as growth and development in an optimal fashion. We have high level athletes we work with. We have seniors. We have people from 3 days old to in
Yeah.
their 80s,
Sure.
and everybody deserves to live a life that's more optimal, whatever that means for them, and for whatever they want to do with their life.
Mhm. That's great. That's great. I think we're on the same page there. Absolutely. That's awesome. I thank you for showing us that scan and talking a little bit more about what you do. As we're closing out here, I just really appreciate your time in educating others and people just having a way to objectively measure or look at the numbers associated with their body other than what they're feeling. So, what's the best way for people to get a hold of you?
Yeah, so our website is lifenocatee.com.
Got it.
Really easy. You can also follow us on Instagram. Our Instagram handle is, let me double check that because
Yeah,
I
yeah,
can't remember
sure.
if we did the long one or the short one. I believe it's Life Family Chiropractic Nocatee.
Perfect.
So
Yeah.
all four words, Life Family Chiropractic Nocatee on Instagram. We've got lots of videos
Mm,
uh, of adjusting babies to see what it's like for children to get
yep.
checked, of what the scans look like. You'll be able to see the scans being performed on people. So
Cool.
we really wanted to remove that layer of fear
Yeah.
because there is an unknown, there's
Yeah.
something
Absolutely.
new.
Yep.
And I appreciate that question earlier on of do they hurt? What's it feel like?
Yeah. Yeah.
Because a lot of times people say, I'd rather live with the pain that I know than lean into the pain of the unknown, which is
Yep.
that I don't know what this is going to be like. And I
Mm.
don't want to see people living in pain when there's a different way or a better way.
Yeah, great point. And I think, what I've really seen some patients experience of yours is, they're feeling better physically, but you're doing those scans and you're like, things are just, still a little off. And then you start diving into other aspects as well that impact their pain. And, that's another conversation for sure. So if things are just really heading your way and if you feel like physically you're doing well, but other stuff is off, this HRV can be a good scan for you to get to at least maybe direct your questioning and direct your resources in another area. So I would just challenge people, just go in, check it out, go through the scan, listen to what you have to say, see what it shows. And if it shows nothing, then great. Like you're on the right track.
Exactly.
But
Exactly
there's
right.
but there's nothing to lose. I mean, there's no harm being done at all. So I really appreciate having you as a resource for my patients and other people in the area. So I can't thank you enough.
Yeah, absolutely. And like I said, appreciate the opportunity to work with you. You're excellent at what you do, and that junction between improving function on an overall level and then
Mm,
tying in the specifics of an injury and relearning some motor patterns in the way that you do that with
mm,
people. It's no wonder why the people that we work with together
mm.
have better results than the people that we work with one-on-one when
Sure.
it comes to injury recovery and relearning, and that the real deep physical problems that can be
Mm,
built in almost for people over a long period of time.
mm.
Relearning those things, unwinding some of that stress and tension, and getting your body functioning better.
Yep.
Sometimes it takes a village, but
Yeah.
doing it the right way and taking those steps, that's the first thing that people need to do, is take that very first initial step, reach out to me, reach out to Dr. Michael, and you'll end up where you want to go
Yeah.
eventually. May not be tomorrow, but at
Yeah.
least you'll
Yeah.
be heading in the right direction.
Yeah, absolutely. In a day and age where people want to pursue more conservative treatments first, and really that's what the evidence shows as well. So we're just aligning
Absolutely.
ourselves with that and with what people want. So I would just challenge people to just, start thinking outside the box a little bit and take care of yourself, and get some good people on your side that are matching your preferences. And I think you're doing exactly that. So I appreciate everything you're doing.
Awesome. Hey, Doc, thank you very much.
Yeah.
Appreciate
Yeah.
you, man.
Yeah. Yeah. Thanks for your time. And of course, we'll chat soon. We'll be in touch.
Absolutely. Have
All
a
right.
great one, everybody.
Yep. See ya.